Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today, I'm talking to Steve Williams, who is a senior clinical pharmacist in a primary care network. Steve, why don't you start by introducing yourself?
My name's Steve Williams. I'm a senior clinical pharmacist at a very large urban primary care network in England, in Bournemouth. It's called Poole Bay and Bournemouth PCN. And before that, I worked in hospitals for 25 years. So I've worked across both sectors, but I've been in primary care for the last 5 years. And I finished up working in secondary care as a consultant pharmacist in medication safety and medicine. So I've got a big interest in systems and safe systems and change management, et cetera, et cetera.
Can you give us a brief overview of your role, what your current job involves?
I call myself a medicines expert. I do a lot of fixing. So I fix a lot of stuff in primary care. And I think the key word is medicines optimization stewardship. So myself and the team of pharmacists and pharmacy technicians that work with me, our job is to provide that stewardship of all things to do with medicines optimization that happens within practices and primary care. So whether that be about antibiotics, high-risk medicines, repeat prescription systems, audits, teaching, anything to do with medicines.
I'm aware that before you started this position, you had a senior position in the health service. How did this transition come about?
I worked in the NHS for 30 years. I'm an NHS believer, and I'm also lucky enough to have been well trained by the NHS, both clinically and I think managerially. So everything that I do, I think now, is the consequence of having been so well trained and worked in lots of different roles. So the timing was just right for me to get out. I'd spent 25 years working in hospitals and I loved it. And I worked as a consultant pharmacist. So I did a lot of stuff, both nationally and research. I'm also an honorary clinical lecturer at the University of Manchester, and I still do research. But I was looking for a work-life balance change, if I'm honest. And clinically, I spent a lot of my time working in medical admissions in hospitals, nearly 20 years. And I became to realize that people were moving so quickly through the system that I was beginning to get frustrated. All this stuff that we call avoidable severe harm due to medicines was coming through the door in medical admissions. But I thought, well, there's all this stuff, whether it's about non-steroidal related stomach ulcers or people bleeding into their brain because they were on anticoagulants, or they were dry as a crisp because they've been given too many diuretics. And so I realized that I was on the wrong side of the fence, and that I needed to do perhaps my best work would be from the primary care end, because let's be honest, that's where most of healthcare actually exists. And so the two together, the work-life balance idea and could I make a bigger impact, was to move into primary care.
I can see that must have been quite a change. And that leads me on to my next question, which is, how easy was it to get started in general practice?
It was, and I was lucky because we were in the first wave in Dorset. I was in the first wave when England decided to start funding clinical pharmacists working in general practice. So there have been, let's be clear, there have been pharmacists and pharmacy technicians working in general practice across the country for decades. It's just that it's been in small pockets. This is hugely funded by the NHS to try and improve patient care and save GP time, and that it does both. But so actually getting in for me was relatively easy, and lots of people are moving around from whether it's primary care or secondary care into it. So, but you need to be supported, okay? So what I hear this nationally, that it doesn't work out for people, whether it be the pharmacy professional or the practice, because they haven't realized what those people can or can't do. And also there's an expectation that they can do everything on day one, which clearly they can't. So given my very extensive clinical and leadership background, I'm going to tell you that I didn't see a patient for a whole year. And it frustrated me, but I spent my time working out what on earth goes on in general practice, to be able to then understand the system, to change the system, to then allow me to do all of those things. So when I've been asked this before, I've said that you probably need to allow 6 months for somebody coming in to understand exactly what their role is and how they can then start to help. You cannot expect people to start on day one and be able to be all singing and all dancing. And to be honest, nobody can do that in any job.
That's a very useful message.